My name is Norman. I'm a physician assistant and I'll be taking care of you today. How may I help you?
I have a terrible headache.
Tell me about the headache.
It is a severe ache on the right side of my head that causes terrible pain in my right eye.
When did it start and do you have any other symptoms?
It started 45 minutes ago. My right eye is very teary and my right nostril keeps leaking mucus.
Have you taken anything for the headache?
No, I have not taken any medication. It's so severe that it even hurts to lie down.
So what do you do?
I pace the floor back and forth, hoping to get some ease.
Well, based on your physical exam, your conjunctiva is injected. The right eye and right nostril both have lacrimation and rhinorrhea. Your right eyelid is swollen and partially open, and the right pupil is less than its usual size.
Why am I sweating so much over my forehead and face?
The sweating is associated with the headache. I think you have cluster headache.
That's what I have.
Cluster headache is less common than tension and migraine. The prevalence is about 124 cases per 100,000 persons. There is often no family history of the headache.
Do I need a head CT? And what are you giving me for the headache?
You do not need a head CT. You are alert and oriented times 3, and there are no neurologic deficits. I am giving you 100% oxygen, an NSAID, and an antiemetic. This should give you a significant relief.
Thank you so much. But what is cluster headache?
Cluster headaches can be explained as follows. At least 5 attacks of severe unilateral, orbital, supraorbital, and/or temporal pain lasting 15 to 180 minutes untreated, with one or more of the following signs occurring on the same side as the pain. That would include conjunctival injection, lacrimation, nasal congestion, rhinorrhea, forehead and facial sweating, meiosis, ptosis, eyelid edema, and there'll be frequency of attacks which would range from 1 every other day to 8 per day. In addition to the primary headaches, namely migraine headaches, tension headaches, and cluster headaches, there are secondary headaches that should be considered also. Let's begin with subarachnoid headache. These patients present with sudden severe onset of headache, often described as a thunderclap. Then there is meningitis type headache. These patients present with fever, neck stiffness, and may be seen in the immunocompromised population. Then there's the temporal arteritis headache. These patients present with jaw claudication, vision change, and polymyalgia rheumatica. Then you have carbon dioxide poisoning related headache. These patients present with waxing and waning headache. Usually, more than one person in the household will present with headache. Then you have the glaucoma headache. These patients will present with unilateral vision change, steamy cornea, eye pain, and redness. And the cervical artery dissection headache, which is normally associated with trauma neck pain, stroke symptoms, and Horner's syndrome. Next, you have venous sinus thrombosis. Usually, these headaches are associated with pregnancy or postpartum or persons who have hypercoagulable state and persons who may be using oral contraceptive. Then you have the intracerebral tumor. These patients usually present with chronic progressive headache, papilledema on the physical exam, and usually there's a history of malignancy. Then you have cerebral infarction, and this could present with ataxia, dysmetria, vertigo, and vomiting. Then you have headaches associated with pituitary apoplexy. And these patients, in addition to their headache, represent with hypotension, hypoglycemia, hyponatremia, visual field defect, and a history of pituitary tumor. And last of all, we have patients who are pregnant and present with headache, suggesting preeclampsia, and they will present with hypertension, proteinuria, non-dependent edema, and pregnancy. You should also be aware that the history of headache is very important. We will start with the onset of the headache. Sudden onset of headache is very worrisome, especially if it was related to exercise, coughing, straining, or sex. Then you have the quality and the location of the headache. Next, the radiation of the pain. Pain that radiates down the neck or neck stiffness is concerning for subarachnoid hemorrhage, meningitis, or carotid or vertebral dissection. Then the severity. Headache that reaches a maximum intensity in minutes is concerning for subarachnoid hemorrhage, venous sinus thrombosis, or intracranial hemorrhage. And then you want to consider the provocation and what makes it better or worse. The question is, how did it start? Pain that is worse in the supine position is concerning for intracranial pressure. The last thing I want to talk about is the physical examination. The important aspects of the physical examination in a person experiencing headache include the neurologic exam, the ophthalmologic exam, the head and neck exam, and the chest and abdomen exam. Well, thank you for giving me the opportunity to care for you today, and I hope you have a better understanding of your headache. Goodbye.